Hello, this is Jonathan Busco, and in this session, we're going to be talking about remote and frontier medicine. But we're going to be discussing remote and frontier medicine from the perspective of the pharmacist thinking about these environments. So, because I'm in Maine, I always think of remote and frontier in terms of cold, but that's not necessarily what we're talking about. So, why are we here? By the end of this session, you'll be able to name at least 4 types of remote or frontier medical practices and at least 5 factors that you should use in the planning process of the pharmacopoeia for a remote or frontier practice. And you'll be able to identify the role of the pharmacist in supporting a remote or frontier medical practice. So what are we talking about when we talk about remote and frontier? Well, from a business perspective, that is the services that are actually out there and occurring on a daily basis, we're talking about industrial sites. So mineral resources, oil rigs, mines, other resource extraction services that tend to be in more remote areas, as well as commercial shipping and similar types of commercial ventures. We're also talking to a certain degree about wilderness medicine and expedition support. And we'll go into detail on all of these things shortly, but think about either the search and rescue team or the medical team supporting an expedition or an adventure race in remote areas. We're talking about research support, so archaeology, biology, geologists, anyone who goes out in the field, particularly in remote areas, have needs for medical support. And then disaster response. I like to think of disaster response more as its own separate category, well worth discussing entirely separately. But I will say that disaster response is or can be very remote or frontier type of medical practice, either geographically or in terms of infrastructure destruction. So I'm going to touch on it, although, as I said, I think that's entirely a separate discussion or separate lecture that can be had. So when we talk about mineral exploration or exploitation, we talk about oil rigs, and those can be land-based drilling sites or commercial ocean-going rigs. We're talking about mining, and in each case, the level of medical staffing is dictated by the governmental laws in the area in which the work is being done, typically. So the requirements for a North Sea oil rig may be different than the medical requirements for a Caribbean oil rig or for a bauxite mine in South America. And that's really important to know, not just in terms of what the regulations are in terms of what medications can actually be stocked, and also in terms of what may be available for restock, but also in terms of what the requirements are going to be for the training of the medical providers. Because if the medical providers have minimal medical training requirements, then there's no point in overstocking them. And on the other hand, if it's a fairly extensive scope of practice, then you need to be thinking about a potentially much greater, much larger pharmacy and all the logistics that go along with that. When we talk about commercial shipping, we really need to differentiate between unlimited license or blue water shipping and nearshore shipping. Generally, nearshore is guided by the laws of the nation or potentially even the state in which the nearshore operation is occurring, whereas in an unlimited license blue water, the International Maritime Organization sets standards and then each participating nation's authority having jurisdiction. So in the U.S., the Coast Guard sets the national standard that meets the IMO standard, and in recent years, the Coast Guard has basically deferred to the IMO standard as the requirement. So that sets the training level, and then there can be very specific requirements for set by that agency for ships that ply the waters of that country. So, for example, in the U.S., a an unlimited licensed vessel is required to have a medical person in charge, a med pick, as opposed to other nations which may require a lesser standard of training for the medical personnel on board. When we talk about wilderness medicine and expedition support, this is incredibly varied. If you're helping a group that's going to do local response, then you need to look locally and say, well, do we ever have any rescues that take more than 48 hours? And if not, that's our limits. That's what we're looking at. But you can get a very good sense of local geography. You know what the search and rescue scenarios are. You know what the local pharmacy and hospital resources are. You can tell what the local EMS resources are. On the other hand, if you're thinking about a K2 expedition where restocking will be challenging, where you will be very remote, and where you will be dealing with a different set of medical conditions, particularly those that relate to altitude medicine, than you might in, say, a search and rescue in Baxter State Park in Maine, you have to think entirely differently about that stocking. And also, again, you have to think about what the laws are where these events are happening in terms of what the scope of practice will be of the medical providers, and also what medications they're allowed to have. Now, specific to wilderness medicine, two very important things to think about are: does the rescuer have to carry everything they're going to use on their back, or can things be flown in or trucked in? Because you're going to think very differently about the weights and compositions and amounts of medications if you have to carry them in a backpack than if you can have them airdropped to you or they're being brought in on a vehicle. And then the other piece of wilderness medicine is that medications will often be exposed to temperature extremes. And so you need to think about the stability of medications in terms of exposure to heat and cold, and potentially even to freezing conditions. So important considerations. For research support, we need to think about what type of research is ongoing. Is it more risky research where you're looking at a much higher risk of trauma because of core samples being done, or a geological access work where you have to rappel into a site and use rope? Do you need to think, for example, do we need more TXA than antibiotics because of the risk of falls? You need to think of the impact of the location. Sometimes a site may be accessible with a 2-hour hike. Sometimes a site may be accessible with a flight to Antarctica, and during certain times of the years essentially be inaccessible, although those barriers have been broken to a certain degree in the last decade or so. Nonetheless, there are sites that are simply inaccessible at times, and so you need to think about what are the worst case scenarios to which the medical providers may be reasonably expected to respond. You need to think about what the medical capacity of the group is going to be. If this is a university research team that basically has everyone trained in first aid or to a wilderness first aid standard, they need very different medication support than, say, a university research team that sends along a trained wilderness paramedic versus a large expedition research team that staffs physicians and has an on-site mobile medical clinic at the research site. And then what are the impact of government regulations at the site of the research? That is, can you take certain medications, particularly controlled substances, into other countries to support a medical team or not? And you need to be aware of those considerations and how to address them if you're going to use those medications. Again, disaster response is a topic in and of itself, but you can think of it in terms of a local disaster response. For example, a community emergency response team, which is doing basic first aid and supporting EMS with some specialized disaster response knowledge, versus an organized national medical response like the FEMA disaster medical assistance team or urban search and rescue teams. And then international disaster response, where you've got organized state-sponsored responses versus non-governmental organizations that respond. And again, how you're going to support them varies on the size of the events to which they plan to respond, their ability to restock, their ability to self-support, and their mission. Is it primarily a mission of infrastructure support, and it's a team that's just basically has a medical component to care for itself, or is it a medical response team that's going to be providing medical care to victims of a disaster? And so those are things to consider as well. So what is the role of the pharmacist in planning in these remote and frontier type events or working in them? Well, the first is planning, and having a pharmacist who is able to work with the planning team, planning committee, to help to decide the most appropriate, most cost-effective, and least burdensome medications to use. Typically, in any of these situations, you're going to want to go for long shelf life and greater stability and a better resilience to physical abuse, since that is more likely to happen anytime something ships out to the field as opposed to when it's sitting locked in a pharmacy or a pharmacy warehouse. Pharmacists can be very helpful in talking about stocking and restocking, as well as storage considerations. And finally, during an actual event, the pharmacist can act as a consultant in two ways. One is as a consultant about the medications that are included in the pharmacy of this rural remote or frontier practice. But also, if you think about events like Hurricane Katrina, where suddenly medical teams were caring for patients who were type 2 diabetics who did not have their medications and who were being brought into shelters, the pharmacists could assist in decision making about the best way to use scarce resources or recommendations on how to medicinally support these patients when they didn't have their own medications, conversions to other medications if such are available. So for those of you in the pharmacy class, we'll go into quite a bit more detail about how you actually do the work of thinking your way through these types of support services. For anyone else, if you have any questions, feel free to post them, and I will try to answer them. Thanks much.